You got to be
My
dancing,
neck,
man. You have
my back, my neck and my back.
to.
What's up, y'all?
How are you, Doc?
Oh, I was doing great right up to the point where I broke my neck.
That's right, because you're dancing too hard.
Hey, look, we got Dr. Mel in the house.
Right, Dr. Mel is
Whoop
here.
whoop.
Look at this. Dr. Mel. Welcome, Dr. Mel. How are you doing?
Doing well. How are you guys?
Doing awesome. So, what we have, this is my first time being able to interview you post mom. So, we do got
Yeah.
to start with talking about that. Talk about what it's like to be a mom and how that has changed your life and how bringing the first beautiful convened baby into this world has been just life altering for you.
First, it's been an absolute honor to have the first convened baby. Um, his name's William Patrick. He goes by Little Billy. Absolutely changes your life. Your priorities completely shift in a second. It's like anybody who's done self growth work in their life, how hard it is to change your priorities and shift like your whole mindset. But when you have a baby, it happens like that.
Yeah. Did you think it would impact you as much? Did you think it would be so life altering? Did you? I mean, because I don't think that's what people don't realize when you think, oh, I'm gonna have a baby, it's gonna, whatever. But like and it does it for the good. It just changes everything.
Right. And it's funny because I reached out to one of my girlfriends because we would have a debate on if your life could ever be completely fulfilled. And I always was on the defensive where, nope, it's not possible. You have to continually grow and get better and better because you're always trying to achieve fulfillment or trying to get something else. But when you have a baby, you're like, your whole purpose is like, it's
Yeah.
crazy. And I messaged her and I'm like, you're right.
Yeah, that's right. Well, I'm going to be honest with you, and I've said this to you a couple times in texts and messages. You can see it in you as a mom. You look great. You can see this glow about you as a mom, and I think that that's something that is so awesome. I remember, Doc. You probably remember in your wife. I remember it in my wife. Just the difference once they became a mom. Just this, it's an aura. It's a glow
I
about
totally remember my glow.
it. You still glow. Shines off the top of your head, I think. Yeah. So then coming up here in a couple of years, we're going to have another conversation. You don't even realize it's coming, but I'll tell you, I was flying Joey Logano, the NASCAR driver, Joey Logano and his wife. We got caught for some weather, and true story. And they said to me, we were caught, and his wife and Joey said, "Hey, can we ask you some questions?" Because they knew I was a counselor and all that. And he said they wanted to know, can you love your second child as much as you love your first child? Because I know right now, Mel, you probably think there's nothing in this world you will ever love than little Billy, ever. And so that was the question: can you love another child as much as you love that? So we talked about it for like 2 hours. It was a great conversation. And what was so funny about that conversation is that I flew Joey Logano a couple months ago, and I said to him, I was like, "Hey, you remember the conversation that we had about the baby?" Because what happened? They went home 2 months later. About 2 months later, they were pregnant with their second. So I feel like I'm the godfather of that second child, and and now he has three. So he was sitting there with Ryan Blaney, and they were like, "Well, here's the deal: you're either a great counselor, or you're a freaking horrible counselor, because I got three kids now." So it's pretty funny. That's pretty good. All right, let's talk about the topic of tonight is healing after surgery, and I'm actually the subject, and you're the doctor. So we're going to actually talk about kind of the buildup and how some of the talk is going to be about how you have used Convene to be able to facilitate working with clients, and I technically have been one of your clients for a while. So talk about a number of months ago we really well it's been a year. You've been in Convene for a year now, really. And so you started helping me with my lower back SI joint. So just talk about how you were doing that and how you were able to do that online.
Yeah. So we have, which is great in the convene groups and communities, you have a discussion board. So anybody who's a part of your community can ask questions. And Matt actually popped on my discussion board one day and told me all about his SI joint. I asked him a few questions back because the platform allows that. And he actually came on as himself, but you can also come on anonymously if you don't feel comfortable sharing your diagnosis with everybody else in the community. And then from there, I was actually able to send him a video of exercises customized to him to start working on his SI joint.
Yeah, which is pretty cool. Because that's actually a great thing because I could go to the old YouTube and all that or do whatever and search somebody that I don't know, but here's somebody that I know and like and I trust, and here you are responding to me basically with a video geared towards straight what I needed. And so I kicked off doing those exercises, and it really didn't make much of a difference for me
Right.
because there were other underlying things, right, that were causing the issues. Yeah.
Wait a minute.
So, what
You're
other things have you? Go ahead.
you're a doctor. So I
Yes.
went to the doctor the other day. What's HIV? I'm kidding. I'm kidding. I'm kidding.
Comic
Oh,
relief here by Doc. So,
so yeah, Matt
go
was
ahead.
doing his SI joint exercises, but it wasn't really SI joint, Matt, right? It wasn't just SI joint anyway. He
Mhm.
had severe arthritis in his hip. So no matter how many SI joint exercises he was doing, it wasn't going to give him much change because he still had the underlying issue. When he got x-rays by a surgeon, they found that he had pretty significant hip arthritis. So why don't you go ahead, Matt, and just explain
Yeah.
what the doctor found? Yeah.
Yeah. So the true history is like I did a long flight back a number of months ago. It was probably October timeframe. And I actually had to airline out to California. And then once I got to California, I got in the jet. I flew the jet back to North Carolina and then back to California. And then from California to Indianapolis, Indianapolis back to California, and then another West Coast to East Coast trip. And then got back out there and airline back to North Carolina. So think about that, how much time in the seat and how much sitting that was. When I got back from that trip, I was barely walking. I was hurting so bad, my lower back, my hip, my SI joint. And so a little bit more of my past history was a couple years ago, I had a torn labrum. Let me go back even further. My history is I had a lot of knee surgeries back in the mid 2000s. Played baseball in college. My knees were really messed up. I had what's called high tibia osteotomies, and those high tibia osteotomies kind of realigned me. Well, what the going theory is amongst my surgeon and all that is those realignments realign my inner joint of my hip. So I kept grinding down and tearing my labrum. So I tore it going into 2019. I had that labrum tear, and that's what it is called, Doc. It is called a labrum, labrum tear, and had that labrum tear, and so they fixed it. Well, again, it started tearing again. That's what the X-rays didn't show it, but the MRI showed fraying of the labrum. So that's kind of the history that led me up to having the hip histories, having the problem, and then going in and leading me to go say, I got to go back and see my surgeon that did the labrum tear. And he doesn't do SI joint, doesn't do hip replacements or joint replacements. He just does labrum tears and stuff like that. And he was like, you're past. What have you done? Of course, they get the history. What have you done? Well, I've done physical therapy. I've done chiropractor. I've done, massage. I've done it all. I've had injections in my hip joints and all that. Nothing's fixing it. So basically, he's like, okay, you're past. You're done. There's nothing. We've done all the band-aids that we can. Go see the hip surgeon for a joint replacement. So I went and found the hip surgery. I got a story about that. I'll tell that later, but it's because it's kind of funny with Megan. And yeah, they did the MRI and they're like, yep, you have your labrum's tearing, all this. So you got some severe arthritis. So it's time. So there we go. That's what led it. I did everything that I possibly could do. Feel pretty good about it. But I was hurting after that trip and all that sitting. It took me about a week to recover walking wise. I was walking like a 90-year-old.
I believe it, because sitting happens to be the worst thing for your hips and your low back. We've had this discussion, Matt, but he is a pilot, so it's hard
Yeah.
to get up and walk while you're flying a plane. But for anybody who has the option and you're struggling with low back pain or hip pain, you really want to get up every 15 minutes or so, get that blood flowing, because your muscles just get so tight. And when your muscles get tight, they pull the bones closer together, pressing on the cartilage in between the bones, which will speed up degeneration and add to onset of arthritis.
Yeah. Well, Mel, this was one of the things that I was really surprised with and it was really before a parent, but I couldn't believe like how weak my muscles had gotten on that side, the right side. Like they were so weak in my butt area and my going down my hips and all that. And it didn't matter what I could do. I couldn't strengthen them. And I always felt like, well, if I can strengthen them, then I'll balance myself out a little bit. So talk about that a little bit because it was not
Yeah.
working, you know?
Yeah, strengthening exercises do take a lot of work and consistency, but also if you don't have the flexibility in the muscles, if you don't have the full length, you can never gain the strength in that muscle. So a lot of people will try to bulk up their muscles and do the same exercises over and over again, and they're frustrated about never getting the full strength back because they never worked on the flexibility, getting the range of
Yeah.
motion prior to doing the strengthening exercises. So if you don't have full length in the muscle tissue, you'll never gain the strength back.
Yeah. And that makes sense. That's been one of the things that I think at post surgery, it's like I can just still feel those muscles are weak. They're just still just like weak. And I know it's going to take time,
Yes.
with the physical
Yeah.
therapy to strengthen those back. Yeah.
You now have the space within your joint, but still those muscles are still so atrophied because, like you said, you weren't able to get the strength prior. That's why pre-rehab, which is so important, trying to gain flexibility and strength to the maximum of your capabilities before you go into surgery. That's going to allow your rehab to go that much smoother and quicker. But you have to give yourself time. It takes at least 6 weeks to gain muscle strength after a surgery. Even if you had great strength prior, because once you have surgery, those muscles completely inhibit and you have to build them up. If you have that muscle memory though, from doing your pre-rehab, you're much more likely to gain strength quicker for sure.
Yeah. That's interesting. All right. So a little bit more on that. It's like, so it leads up to the surgery, and the funny story about that is, so Megan, my daughter Megan, everybody knows Megan is in medical school, and so I was talking to her, and we had talked at one point. She's like, "Yeah, there's not that many orthopedic surgeons that are female. It's more male, but that's kind of changing. Whatever." So I went and picked her up over Thanksgiving, and I was driving her back home. Well, I had gotten referred to this Dr. Hartzler. And so I go on to research Dr. Hartzler because I'm going to make sure, they got good reviews before I go let somebody cut my hip out. And I see that it's Dr. Molly Hartzler. And so I'm reading about her bio and where she's from and all that. And she's Mayo Clinic trained. So I'm pretty impressed that she's from Mayo Clinic, Minnesota, trained and all that. So I'm like, yep, that's her. And you read her reviews. This lady is a goddess of surgery. Like, I've never read such glowing reviews, and I thought it was pretty cool because her reviews were she's more than just a surgeon. She's a caretaker. She cares about you. She spends time thinking about who you are and talking to. And that's what all her reviews were. They were just glowing and all that. So I was really, really impressed. And so I told Megan, I said, Megan, I found this surgeon. She's like, yeah, who's going to do it? And I said, well, Dr. Hartzler. And I said, but Megan, I was surprised. It's Molly Hartzler. And she looked at me like, how could you say that? How could you say that it's a female surgeon and you're shocked that it's a female surgeon? Because she's trying to become a surgeon. So it's pretty funny. It was pretty funny in the conversation. But so the last thing, so I go into surgery and I'm in there. And so I don't remember this, but I guess I had a whole conversation about Megan going to medical school. And so when Dr. Hartzler came and saw me afterwards, when I was back around, she said, hey, your daughter, if she wants to, she can come do a follow program with me over the summer for a couple of weeks if she wants to come follow me through surgery and all that. I was like, that is so cool.
That's
I thought, yeah. So I thought that was pretty neat. So I told Megan and Megan hadn't really thought about orthopedics, but now, it used to be, this, Melly, to move somebody's joints and body parts around and do all this stuff. It's not a light thing, So yeah, more people are doing it. More females are doing it because now you got power tools and tables that move with you and do all that stuff. So it doesn't take as much, I guess, strength, Little Megan in there, 5'2".
Sponsored by DeWalt.
Yeah, my son wouldn't be proud because he works from Milwaukee. So, yeah. All right. So, so go in there, get set up, and I get the surgery. And so we talked before, and you gave me like, okay, this was what was very shocking to me. And I remember talking to you before. I'm like, well, wait a minute. Because I had to do a pre-physical therapy appointment here. That was one of the prerequisites, and I came right out of that thing. And okay, I'm 51, so 51 years old, and they're like, I know I'm old, almost as old as you, Doc, but I'll never catch you. But I was shocked that they said, okay, this is it. We're going to hand you these exercises. You don't need to come back to physical therapy ever. And I was like, really? And they're like, well, you're young, you should recover. And I remember hitting you up right away going, Dr. Mel, this is what they told me. I don't need physical therapy. I just need to do these first round of exercises. So is that true?
So it's every surgeon is different with their protocol. Some are less likely to send patients to physical therapy status post. Hip replacement, with a knee replacement, everybody pushes therapy. But with a hip replacement, because the surgery it's a ball and socket joint, so it is much more flexible. With the knee, you really have to range it, and you can't really do it without the help of a physical therapist. But I really don't feel that somebody should not be seen by a physical therapist status post surgery. Obviously, because I'm a physical therapist, but mainly because after the first 4 to 6 weeks with anterior approach or a posterior approach, you still can't do certain movements. And I find that a lot of patients who don't get physical therapy, status post hip replacement, they're afraid to move into those movements that they're supposed to be restricted in. And then what happens is they're still tight in the hip that they got surgery on. So they end up having the same issues quicker than somebody who has gone to physical therapy, improved the length in that hip joint to prevent them from having the same issues again. Yeah, these hips are like you're having like a brand new hip, but you can still damage it over time if you're not gaining the flexibility and strength in the muscles properly. Because if you're imbalanced from one side to the other, you're going to have poor pelvic alignment, and that's going to increase your likelihood of decreasing that space in that joint again. And I've had patients who come back after a second hip replacement. So the main thing is when you see a physical therapist, they're going to show you your imbalances. You can correct those, and you can prevent yourself from ever having an issue again. I tell my patients when they come to me after a hip replacement, I'm like, you got a fresh start. Now you can do these exercises right, change your posture and alignment, stop doing the things that caused this in the first place, and you'll prevent this from degenerating and it can last you longer.
Yeah.
then you didn't go to a physical therapist.
Yeah. So, I mean, so yeah, so they gave me the first 2 weeks. You gave me the first 2 weeks. Same exercises, pretty much. But I feel like, and this is what I've told you. Like, I did those for 2 weeks. I'm 2 weeks post op today. Is what's
Right.
where I'm at. Well, 2 weeks post op yesterday. Um, you seem to move past those first little range of motion, laying in your bed, doing your feet, tightening your butt, sliding your foot back to you, sliding your foot out, those things. You get past that, it seems like pretty quick, or I felt like I did. So I got to
Right.
progress. And that's where, like, the pre op appointment ended right there. That's all I got. Right. And so that's where I'm like, Dr. Mel, help.
Yes, yes, yes. So those exercises are just to make sure you have range of motion in your ankles, knees, you're gaining strength back in your quadricep, but they don't address the glute, which is weak on a lot of people, and the hip abductors, which are really weak on a lot of people. And it's a lot of the reason why these patients are getting the surgery because they have weak glutes and weak abductors, or tight glutes, tight abductors, or tight inner groin. And I find that is very common in all the patients I see who need a hip replacement to begin with. Is they're tight in their inner groins, they're weak in their glutes, and they're weak in their abductors. So if we can correct these imbalances, that's what's going to help them more than anything, to tell you the truth.
Yeah. Well, that's exactly where I was saying. I mean, that's what I was talking about. In all the places
Yeah.
that you just said, you use more professional words than me. I use my butt, my glutes, just weak, right? Just, I mean, horribly weak. You know, all of it just weak. It's still weak. That's what I've been really shocked about, is how weak it is. And I feel like it's weak. Like, I know if I don't get it right, it's going to mess up again. I know it.
Right.
Right. So the progressing to the next level, and that's where we're at, is progressing to the next level. I did my 2 week appointment today. Now it's time to get after it. How are we going to do that?
Exactly. And that's why communication is so beautiful, because I can show you not only giving you a detailed PDF instruction like you get from the doctor or your physical therapist in person, but you'll have a video that you can follow step by step every day with me barking at
Yeah,
you.
exactly. And me reporting in. And that's one of the things that I think is so cool. We have a group. So we have a group, me and you. It's just my group with you. It's a private group with you. And so when I'm feeling something, and this is what I tend to do, when I'm feeling something, I can have those conversations, really the personal. I mean, you're the doctor, I'm your patient. I can have those personal conversations with you, and nobody else is seeing that. That's just in a group for me and you. And so if I'm really hurting, or I have personal questions, I can say, I'm feeling this, and not have to worry about Doc reading it over there. Doc, different Doc right there. Or anybody reading it. That's what I'm saying. So have you been able to leverage that? Because you do this not just with me, but you do this with other patients and stuff like that.
Yeah, it really works out really, really well. Recently, not only you, I had another patient who came to me with a rotator cuff. She was really hesitate a rotator cuff inflammation, wasn't a tear. She was trying to get it built up to prevent surgery. And she was looking at the prices and the copays of going to a clinic. And she was like, it was just out of her budget. So she came to me. It was somebody from my local church. And I gave her everything she needed plus more, right, virtually for a quarter of the price that she would have had to pay if she went to outpatient. So it was just such a blessing for her. She's doing so much better now. And yeah, so it's just another way not only to take on new patients you can't afford going to an outpatient clinic, but also maintaining a relationship with my patients that I see in the homes, that I can continue with them virtually if they feel like the insurance gave out and they just wanted to continue some therapy at a lower cost than going to outpatient. So it's been a blessing, not only for me to stay connected to my previous patients, but also to bring on other patients that may have not got treatment because they couldn't afford going to an outpatient clinic.
Yeah, that's really cool. And then, I know that I could probably go request more
Right,
therapy because I haven't done it, but why would I do that? If
right.
I'm, working, have somebody I know, like, and trust, and I can work with you and get what I need, to do that. So it's really cool. It's just a different way to think about doing it. I don't think there's really many more platforms out there that allow this flexibility. You could go out and use one of the other platforms and, you know, here's ten exercises that you can do post hip, post op total hip replacement, but it's not customized to me. I don't have the access to you when I have something going wrong, or I feel like something's bothering me. That's the key. The key is you're the expert, you're the doctor. You've gone to school and have all the expertise.
Exactly, because the cookie cutter exercises aren't going to be customized to your issues with your SI joint and your low back and everything you've been through prior. So it really is important to actually speak to a physical therapist. That's why I don't like when surgeons say not to follow up with one, because everybody's so unique and you have to treat the individual. These 3 exercises that they give you in the beginning, yeah, they're going to get you started. You'll get to walk again, but your pain may not be completely resolved after just doing those 3.
Yeah. So let's take it even a step further, because one of the things that you do in the health and wellness is you don't just talk about the physical treatment of my hip, giving me the exercise, strengthening the exercise. You talk about the holistic approach, the mind, body, the spirit, all of that stuff, because you teach yoga and all that. And so in doing that, it's surgery, especially a surgery like this. And again, I'm on the younger side, but you have some older clients, some older patients. It's a mental exercise when you go through something like this. It really is. I mean, it's a lot, to be honest with you. And so one of the things, and to go into this, is one of the things that I'm dealing with is some swelling in there around the joint. Not necessarily the joint's doing fine, but it's actually around the incision and all of that. And so if I go back in my history of surgeries, which if anybody's watching this that knows me, I have a history of having a lot of surgeries. I've had a lot: knees, hips, all kinds of things. And in one of my knee surgeries, I ended up getting an infection afterwards, where they had to go back in and they had to clean it out, which that could be a big deal, right? An infection in there. That whole process started exactly like this one. Oh, you got a hematoma, a subcutaneous hematoma, and it should resolve itself. And then it didn't resolve itself. And then all of a sudden one day it's on fire and feeling warm and then the next thing you know, okay, surgery tomorrow, you know, and that's how it went. It went that fast. Boom, boom, surgery tomorrow. And I was in. That's like a mental thing to me right now. Like, I'm sitting here thinking through it, going, "Oh crap, am I going to be okay?" I'm sitting here telling my work, I'm telling my boss, like 6 weeks. That's the max. They told me I'll be back in 6 weeks. Well, am I going to get delayed? Is it going to, cause me to, stay out of work longer? All that, from flying. How do you deal with that?
Yeah, it's so hard, especially when you had a past trauma that almost replicated and copied that. So it's that fear of it happening again. But it's so important to understand the facts, know what you can do to control your current symptoms now, understand that you don't have an infection, you have a hematoma, and there's things you can do to prevent that infection from happening again. And the main thing is, I know you, Matt, you sit a lot, whether it's being on a podcast with an hour with Dr. Mel or with the rest of your beautiful beings and convene communities. It's very hard for you to take care of yourself. You're a man who has kids and takes care of a large community. So reminding yourself that your self-care is so important now. And I know everybody knows this, but you need sometimes a coach to remind you that you're just status post-surgery 2 weeks. You should be icing and elevating. Sitting is the worst position for you. And that's a lot of the times people who build up a hematoma is because they're sitting too much. That blood flow has to go back to the heart. If my heart is above my feet, that blood flow is not coming out and circulating out of your system. So what I would recommend to Matt is after every call he has, and schedule 15 minutes in between each call to make sure you ice and elevate for at least 20 minutes. Get that blood flow to rush back to the heart. So when you sit up again, it doesn't pull for too long and bacteria will not build up and you won't be at risk for an infection.
I'm on
Yeah.
it. I will be calling you every 15 minutes.
I love it. You got an assistant, Dr. Mel. You got an assistant. That's awesome. But that is good advice. I do find myself sitting here quite too much. I had a call earlier today. It was supposed to be, an hour call. It goes an hour and 45. And then I stand up and I'm like, oh God, I feel it. And that's not what I should be doing. I did just order, now that I've kind of coming back into the office, I ordered more ice packs, so I can keep some here. We have a kitchen in the office space and I'm going to keep some in the thing here. So just thinking through stuff like that to try to, make it through, exactly what you're saying. Thanks to your advice.
Kate
Which is
has a
good.
great point in the room. I don't know if you've read that or not. She says, I think it helps when others give us permission to care for ourselves. We shouldn't need it, but the reminders and encouragement make a big difference when we are in service industries. And she's absolutely right. We're all guilty of it.
Yeah.
Yeah.
Yeah. Who said that?
Kate.
Okay. Yeah. And she should know because she's a PA. There you go.
Yeah.
That's right.
Doctor,
What
and
we tried
doctor.
to do. That's what we try to do. We have the physical therapist, Dr. Mel. We have the PA, Kate. We have Doc here, who was, Doc, who is a nurse, not just a doc. Well, we call him Doc because he was a paramedic. Well, you can explain it, Doc. Why don't you explain what you
So
did?
I was an independent duty corpsman for over a decade, and essentially what that is we're very much like a PA. Minus the pediatric and geriatric didactic of the course. So what we do is we go out independent of doctors on ships, submarines, special forces, Marines, you name it, and we're responsible for the health and well-being of our crew. And it can be very, very hairy at times, a lot of pressure. I've had doctors where I've sent off a medical assist message, come back and tell me, boy, I'm glad I'm not in your shoes. So it's crazy.
Yeah. Yeah. So you did that and then you became a nurse in the Navy. So we have a lot of medical here. Yeah. And then my wife is a nurse, so that's been really good. She's really taking care of me. Like really. I will say this for anybody, you come out of the surgery like that and your medication is Oxy, right? So you have Oxy sitting right there next to you and all that. Mine never sits next to me. I have a dispenser. My wife is in total control of that. Not that I worry about that. Where that came from is when I had those knee surgeries done a long time ago. I was on a lot there because high tibia osteotomies they're bad surgeries. And so I was taking Oxy and morphine at the same time, then Oxy and something else at the same time, and then Oxy and something else and Valium at the same time because that's the issues that were going on. So it was a lot. So then it was like, okay, now we got to go back off of that. And so I have never had a problem with any type of taking anything, medication afterwards, But when I was on such high doses of Oxy, like it was the weirdest thing. I know I've told Doc this, but when I was tapering off the Oxy and Tisha was in total control of it, I would be sitting there because it messes with the nerves, right? That's how it blocks the pain. And it was like I was sticking my finger in a socket. It was like I put my finger in a socket and it was like I was getting shocked. So she would see me and I would just like, I would go like this. My head would move back and forth because it was like my nerves were getting shot. So I could see how at the time we talked about it, I could see how if you were taking a medication like that, you'd be like, "Well, I don't want to feel that. Give me one." I don't want to feel that. Give me one. And then you get into that, taking that addiction side of it. So it's something you got to really be careful with. Um,
Yeah.
but yes, you control it. I progressed through. I've been off that, since last week. Don't really need it, but you need it. You obviously got to go through that, right? What's your thoughts on that, Doctor?
Yeah, for hip replacement surgery, it's painful. Thankfully, it's not as painful as your other surgeries, and it's less painful than most surgeries. I find that out of the orthopedic surgeries that I treat, the hip has the best recovery time, and I find that most of my patients can get off those heavy pain meds within 2 weeks. So I'm
Yeah,
glad you were able to as well, Matt.
yeah.
Dr. Mel, what
Well,
are your
I want
thoughts
to.
on? I'm sorry, Matt. Go ahead.
No, go ahead. Go ahead.
Uh, I just want to know your thoughts on taking NSAIDs, Vice, just straight up Tylenol post recovery.
So unfortunately, NSAIDs I would normally prefer for to reduce the inflammation, but a lot of times surgeons put you on a blood thinner, and you can't take NSAIDs with a blood thinner. So then you can only take Tylenol to reduce the pain, and they usually put you on a different kind of inflammation, something for inflammation that doesn't contraindicate with the blood thinner.
Like
So,
Well,
possibly a
and
like right now.
steroid.
yeah, NSAIDs are usually not prescribed until like 6 weeks post-op after you're off the aspirin or heparin, whatever you're on
Yeah.
for the blood thinner.
So I'm on aspirin and
I,
then Tylenol now, and then I don't. This is the wrong word, but Coumadin or whatever. What is
no,
something like
you're
that?
on point.
You got
Yeah.
it.
I
So
ask
yeah,
because Matt, being a former Marine, and a lot of people out there, a lot of the first line medication they go to is they pop that Motrin, and I think
yeah.
it's very important to highlight the fact that might not be a good idea in this case.
Definitely
No.
not. Definitely not. You definitely don't want to just pop Motrins if you're on a list of other medications from your doctor. So anything over the counter, you have to check with your surgeon before
Yeah.
taking it. It will interact with the other stuff you're taking from the surgery.
And it was very interesting because they were very specific at the doctor's appointment today about that. Do not take any of these, and gave me the list, on the sheet of paper. Do not take these, and they were all what you're talking about. They were all listed that and naproxen and all that, whatever. You mentioned it earlier, but I want to talk about this since we kind of focused on hip right here. But talk about the difference between anterior, posterior. I had anterior, and how that can affect your recovery.
So if you are a candidate for anterior, it is much easier to recover from an anterior hip replacement than a posterior, because with a posterior hip replacement, they have to go through more of your fatty tissue and muscle. You have your glutes, you have your external rotators through the posterior side, and it's a larger incision, a lot harder to get the hip replacement in through that area, and they have to cut through some of your muscles, so it's a longer recovery. With the new anterior approach, they can actually separate the muscles with forceps, not cutting a single tissue, and get the hip replacement in through a much smaller incision. And it's a much quicker recovery because also there's less precaution status post an anterior approach than a posterior approach. With an anterior approach, you only have to avoid external rotation and extension. So you are less likely to dislocate, because with a posterior approach, you have to avoid flexion and crossing the leg, which is a much more common maneuver that people will do. So, like to sit down on a toilet, you're going to
Yeah.
break precaution. And that's a very common way I've seen people dislocate their hips, status post a hip replacement, a posterior hip replacement is sitting too low, too fast, or getting up from too low of a surface. You're more likely to dislocate that way. So you're very lucky you're a candidate for the anterior approach. Much quicker recovery and less likely to injure yourself.
Yeah, that was great. And you had told me that. You had asked me the question, "Are you getting an anterior?" And I was very, kind of reading and all that. You had said that to me early on, and I was making sure that, the doctors that I was seeing, I saw two different doctors and picked, Dr. Hartzler, but that they did that approach anterior, that it was going to be anterior. Did not want to go posterior, which is good. Yeah, yeah, that's cool. I just wanted to make sure that we mentioned that and talked about it. So
Yeah.
cool. I mean, look, I love what you're doing. I love that you're a part of Convene. If you're somebody, and there are people who have inquired, if you're somebody who's a physical therapist or a fitness trainer, um, get in touch with Dr. Mel. Talk to her about it. The ultimate goal, talk about wanting to grow this amazing community. It's not just about you and that community, it's about growing other ones and all that. So talk about that a little bit.
Yeah, if you're somebody who has a blog or just wants to serve a larger community than just the individual patients you see, or stay connected with your patients. How many times do patients ask for us to stay connected and it's hard to follow up because we're just so busy? But now you can just drop them a link, say, yeah, reach out to me anytime in my community, hop in the community, join so we can stay connected, bring other people who need my advice. There's so many times, like Matt said, you hop from one therapist to a next, and then you got to retell your entire story. It's nice to have somebody that that somebody you trust, like Matt said, and we're always looking for other therapists to come join because Dr. Mel can't help everyone. As we grow, more physical therapists to serve. There's so many people that can use our services, especially now after surgery. Almost everybody is recommended physical therapy. Maybe not as much for the hip, but for back surgeries, knee surgeries,
Mhm.
everybody has to see a physical therapist. And we need more and more physical therapists out there that are willing to serve and help.
Yeah. And in this community, you do not just do physical therapy, you do yoga. So please talk about that a little bit, all the stuff
Yeah,
you
I
do in there.
also have a group where I share yoga videos. I do 15 to 20-minute yoga videos for all levels. I try to do a lot of beginner stuff, but I do have some things that are more advanced. People reach out to me who are interested in starting yoga, but have multiple injuries that they've always been afraid or too timid to actually start because they were afraid that certain poses will affect their low back or knees or hips. So it's nice that I have not only my physical therapy background, but also my 250 yoga cert. So I can help you get started on your yoga journey as well. I'm always looking for yoga instructors to help me out as well. And I'm happy to help any new yoga instructors get familiar with precautions and things that they should be aware of when a new patient comes in or a customer comes in. I'm always happy to help and serve you get started. But I would love to not only be the only teacher in there, but have multiple different teachers because not everybody gels off of the same teacher. You need different personalities, and it always helps to have more people serving.
Yeah. And I've told you, Lainey, my daughter is starting her yoga certification. So pretty excited about that. Get her in touch with you and we can get her in there.
Yeah, I can't wait
So,
to have her.
yeah. So it'll be good. I love it. So that's exciting too. All right. One other thing I want to talk about and get into is you have a podcast that you're now bringing in here. So why don't you talk a little bit about bringing it into Doc's podcasting community? So Doc is the man podcasting community. We'll let him talk about what we're growing in there and all that. But talk about your podcast that you and your sister have started together. This is cool.
So me and my sister just launched our podcast. It's called Blissful Beings, and you can find it under the podcast community and Convene that is run by Doc. So I'll let him share a little bit more about the community. But it's pretty much just about our sister combos, things that we have discussed our whole lives, and just our journey. She is more in the financial space, which is great in terms of Convene because it is also a business platform. So not only like I've really turned to her about financial advice, how to grow a business, things like that, because I have no clue. I don't have my doctorate in finance, but she has her accounting degree, and she is brilliant in that space. She runs Simple Lending Financial. She's the CEO and founder, and she's building an empire. She's really remarkable. So you not only get the business side from Janine, but you also get the health and wellness side, and just some awakenings we've had through our lives and things that through our journey that really opened our eyes to a new perspective that just allowed us to just remain on top and stay well throughout the struggles, you know. So we're always
Yeah.
looking for people to join the Convene podcast community and just give us ideas for new episodes and listen in to our current episodes.
Yeah, that's cool. Have y'all always been close?
Yeah, very, very
Yeah.
close.
Yeah, that's
Mhm.
cool. Me and my brother just we're close, but we've gotten really close last couple of years, and it's like we FaceTime each other every day. There's not a time that we don't FaceTime each other and all that. Maybe me and him. It would be a foolish podcast if we did it, but it would be good. Yeah, that's cool that y'all are doing that. But the idea is of your podcast is really cool. And the cool thing about having a group like this is people are not just listening to your podcast. If they come and join your group, they get access to you guys. They can ask questions, right? Ask you. I could come into that group and I could ask you a physical therapy question. I could ask you a yoga question. I could ask a finance question of your sister and all that, and y'all could address it on the show. You know, when you see it the next time or whatever. That's
Exactly.
cool.
Exactly. That's what's so great about it, that you can actually connect. Because if you go on Spotify and listen, you're not going to be able to get access to us. There's no way to comment and us to correspond with you. But if you hop in our community on Convene, you can ask us a question, and yeah, we can address it on the next episode, or you can just drop us a line on a topic that you want us to talk
Yeah.
about. We can talk about it on an episode. We're always looking for input.
Yeah, that's cool. Doc,
Well,
talk about your community.
funny you say that, because in our little podcasting hub, I don't want to call it a group, I'm going to call it a hub, because I'm really excited about what we're doing here. We're going to develop our own community as far as networking for guests. So we'll be able to go there and get guests that way, get your ideas for your podcast. But we're also starting basically a tutorial, so a class for those that want to know a little bit more about podcasting, whether you've done it before or you haven't, you're interested, you think you can't do it, you can, and we're going to teach you. And we're going to teach you not only how to podcast, but we're going to teach you how to network. We're going to teach you how to market it. We're going to teach you how to get it out there to the masses, and so much more. And just like you said, what's great about the group is you come in and you join. I listened to your show last week, and man, I had a question about this. So let me reach out to you. And I'm getting real-time feedback, whether I'm watching or I just reach out to you, and you're going to get back to me immediately. So
Yeah.
that's the goal. And, not only learn how to podcast, but hey, just come in and maybe you'll find a show for you.
Yeah.
Exactly.
Well, let's look at this show, right? I watched leading up. I'm just the type of person. When I'm leading up to a surgery, this is a major surgery, right? Getting a new joint. I watched so many videos and all of that. So here's the deal. We've put together, this show. If somebody comes back and watches it, 2 months from now, 3 months from now, and they come into Convene, we're going to let them know through the podcast, the video, the podcast, the write-up, we're going to let them know where to get in touch with Mel, where to go join her group, and so the ultimate goal is that you'll follow my lead from going, and getting Mel to help me. It's all right there, and it's in the group, and you can connect with her. That's the ultimate goal. As this video gets out there, gets watched, we're helping you grow, hopefully, your business, but it's because of the great work you're doing and how much you've meant to me in this whole process and all that, which is great, so which is cool. Yeah. Well, it's amazing, I couldn't appreciate you more. It's been, this is a process, and the process is not over, everyone. I asked Mel to come on here and to the wellness community and to talk about this because we could bring Mel on to the Wednesday night one, but I think, we've addressed it a little bit, the wellness side of this, the mental wellness side of this. For me personally, and Mel will kind of close, continuing to talk about this a little bit. For me personally, it's been a years of lower back issues, SI joint issues, hip issues, not exercising. I'm gonna be straight up. Not exercising, not being in good physical health because I hurt so much. From when I met you, Mel, and we did Convene 23, that's when I first met you. You came in February, Convene 23. I've lost 46 pounds since then because I had gotten so out of shape because my back hurt. I wasn't extra. I wasn't doing anything. And it's because it's just the family and the thing and getting your help and getting moving and, changing my diet around and doing different things like that. It's because of, Kate on here watching, talking and getting her helping me with that. You helping me with that. That's what this family does for each other. That's what Convene does is it's a true family. Everybody is out there to help each other, to take care of each other. We are all service oriented, which is a wonderful thing. And so we're doing great things, So talk about that a little bit. But hold on, back up. It really affected my mental wellness. And I don't get affected much. Not much affects me. But that's how it was affecting me. I was not where I wanted to be, and I honestly feel like getting this hip fixed. And now if I can get over this swelling and this last little hump, I feel like I'm where I need to be to now take it back up to the next level as an old man that I need to.
It's given you the hope you needed to get that motivation and get started. I think that's what happens to people. You just start letting yourself go for so long, and then it's so hard to get yourself out of the slump. You just have to start taking action, but you're afraid to because you're in so much pain. But if you get the guidance from a physical therapist, you can take baby steps in the right direction, and you realize, I might not be able to do what I used to do, but I can do this, and I can start here and start building my foundation. And then when you start with a little bit of exercise, it's like a snowball effect. You complete one task and then you're ready to tackle the next. But if you don't complete that first task, you never get off the ground running, And Convene is the perfect place to serve whatever you need. You may be in perfect health and you may not need a physical therapist, but there's so many people that are serving in the community. If you need financial advice, or you are interested in publishing a book, or you want to start a podcast, it's just a beautiful platform to be a part of because it helps in all aspects of your life. There's somebody really for everyone.
Yeah, absolutely. The word convene, it says it all. Convene means come together. Where are we going to do that? And communities. And we call ourselves a platform with a purpose. And that's really what it is. Service-driven people, even talking about podcasting, Doc, is, we've done a lot of podcasts together so far, and we've watched other people do podcasts, and we know that there's little advice that we can give people to make their podcast better and to grow great things. And that's why, talking to Doc, building that training out there is important, to give people that confidence to get out there and do what they want to do and to pass their message and their story along. It's really cool. So I applaud you. Doc has come a long ways. That community's come a long ways in just a couple of short weeks. So I applaud you for that. You jumped in and got after it. You want to talk about that real quick, Doc? Because, encourage people to just go if they got something they want to do.
Yeah. So, I have put in a lot of work. It's not where we want it yet, but it's definitely getting there pretty rapidly. I'm just waiting on this picture some guy was supposed to send me. I don't know, but anyway. Speaking of, no, it's great because we're gonna teach you from step one, all the way to your basic essential equipment that you're gonna need to get started, up to maybe more advanced equipment. But we're gonna also teach you how to set up your podcast, how to structure it, how to go through and how to interview guests. We're going to teach you we're going to go as far as teaching you how to even potentially do convene community conferences.
That's right.
And
Glad
all
you said
kinds of
that.
stuff. So I would
Yep.
teach you how to produce a podcast. If you want to do everything on your own, that's great. If you want to have somebody like me to help produce it for you, we'll teach you that as well. I'm really excited about it.
Yeah.
For the most part, I've got it almost where I want it. However, we're still working on the instructional video portion of it. So it's not just going to
Yeah.
be, hey, come in, click, and read some stuff, and bam, bam, pay your money, and that's it. No, we're gonna break it down, as we like to say in the military, Barney style for you.
Yeah.
Very.
That's right. That's right. So you can see up in the upper corner, donate to Doc. He does this out of the kindness of his heart for Convene. Drop him $1 or two and all that, and it just helps him run the show and us continue to build on it, which is wonderful. But yeah, that community is going to mean so much because I think if you're a content creator, you should be a podcaster. Look at you, Mel. You and your sister. You're out there podcasting now. It's awesome. It builds confidence. It builds confidence in who you are and what your message is, and talking and all that, and you know, networking, building guests in there, and all that. It's a fun thing. It's really really good. It's helped us grow quite a bit, which is great too. So cool. Um, all right, we'll close it out. Mel, we'll come to you here in just a second. But Doc, what do you got to say about this show?
Fantastic. There's been, I'm sure, many people in the past have had hip replacement surgeries. There's going to be many people in the future, and I guarantee both parties have many, many questions. And fantastic job, Dr. Mel, getting it out there and breaking down some of the myths and what you really need to do and what you don't need to do. I loved it. I love it a lot. I'm disappointed we don't have more people watching, but we will get it out there, and you can come back
Yeah.
and watch it at a later date.
That's right. We changed the time tonight, but that's all good because we've got the baby and all that. But no, this was a good one. Again, as soon as they told me I did not need any physical therapy post surgery, I was like, "Oh, that just seems crazy to me." Not that I might could go watch these, but why not go to the expert, Mel? And that's really what this is about. It's about go to the expert, go to somebody that you trust. I don't want to go through this anymore. I want to raise my level back to where I think I should be mentally, physically, emotionally, and spiritually. They all go together. And I truly feel by the help that you've given me and the help you're going to still give me, that you're going to help me achieve that goal. And I could not appreciate you more. It means a lot to me. You just being in Convene means a lot, and I really appreciate it. Like I said before, you're a glowing mom now. It's really really awesome. To see all the great things that you're doing in your life, and makes me proud that you're part of Convene. So thank you so much. So we'll give you the last words, and then Doc will take us out of here.
Well, as always, thank you so much, Doc, and thank you, Matt, for making it possible for me to be here and serve others. It's something I've always wanted to do. And now I'm able to, with people like you guys, having this podcast, Doc, and Matt running the Convene platform. It means the world to me. I recommend anybody who wants to get better in some way, whether it's mind, body, or spirit, come join the health and wellness community in Convene, and you can find my group at Live Well with Dr. Mel.
There we go. There we go. All right. Join us February 24th. That's what Doc was talking about. We have the Convene 24 virtual. Dr. Mel, you're one of the special guests that day. So we'll do it again that day and talk about some stuff and great things you're doing. All right, Doc, thank you as always. And everybody, thanks for watching, and share this video out if you know somebody who needs a physical therapist or somebody coming in for surgery. It'll really help.
We'll see y'all next week. Bye-bye.